Hello. I'd like to start by sharing with you a personal story about my own journey to finding connection. So just a few years ago, I lived a very typical physician life. I worked for a large health system. Every day I went to work, tried to be the best doctor I could be, the best team player I could be. I performed some administrative duties. And on the home front, I cared for my 4 children, tried to make time for my husband, and occasionally made some space for coffee or lunch with my mom or a friend. It was a good life. But yet, on most mornings, as I stepped out of bed and placed my feet on the floor, one of the first thoughts to cross my mind would be, I'll be happy when this day is over. And then as I caught myself in that thought, I would think, why are you wishing your life away? You have a good life. You have a great life. And there are children literally starving to death in the world. And here you are complaining. So I would gather myself, gather my thoughts, and promise myself that from that moment onward, I would live with intention. I would be present for my life. And I would try to find joy in every moment. And that might last for a few hours if I was lucky. But sooner rather than later, I would be right back where I had started. I felt very alone and very isolated. I couldn't share with anyone how I was feeling, what I was thinking. All of my colleagues always seemed to have their lives so put together. And if I shared any of this, it would be showing weakness. And what would my family think of me? So I continued the farce. Every day, I gathered every ounce of willpower to continue playing the role of perfect doctor, perfect mom, the one who was confident, was in control, and could do it all with ease. And this is how my life continued for several years, until June of 2018, when I was diagnosed with invasive breast cancer. And then my life as I knew it came to a screeching halt, and I was thrown off the roller coaster. I was so scared, so sad, and so angry. How could life be so unfair? But as the days and the weeks went by, I was finally able to stop feeling sorry for myself and step forward into a place of acceptance for what was. And then something very unexpected happened. There was peace and quiet in my mind. How or why? Well, all of the voices of the expectations, of the shoulds, of how I should be, how I should act, what I should do, what I should want, what I should have, they were all suddenly quiet. I was sick, and it was clearly visible to the world. So why continue the farce? That my life was perfect, that I was perfect. I was finally free to just be me. And this led to rediscovery of myself, of my deepest values, of my true essence. And I found a lot of clarity about what it is that I truly value in my life. And with this newfound clarity, I also became a much keener observer of the world around me. And now from this new position as patient, I was able to witness how challenging it was for my doctors, my colleagues, to connect with me on a human level. And I was able to see my old self in them. You see, the greatest current problem that we are facing as humanity is the epidemic of disconnect. Disconnect from ourselves and disconnect from each other. As human beings, we are primarily wired for 2 things. 1, survival, and 2, connection. This has been proven by a plethora of studies dating all the way back to the early 1900s, and more recently corroborated by Matthew Lieberman from UCLA. We all understand survival, but why connection? Well, connection, because it is essential for our survival. Our ancestors' survival depended on their fully belonging and being supported by their tribe. Chances of survival alone in the wild were significantly diminished. So from the time of birth, they knew how important it was to be part of the we, of their tribe. However, with the passing of millennia, with the advancement of technology, and with the taming of the wild, has come the era of individualism, of self-sufficiency, of self-reliance. And this philosophy of this philosophy of me, I should say, has pervaded every aspect of our society. And the profession of medicine has not been spared. In a profession where it is of the utmost importance for us to communicate, for us to build trust, for us to create very unique connections with our patients and with each other, our training highly emphasizes a separatist agenda. From our early years as medical students, we are told not to get too close to the patients, not to share too much of ourselves, not to show our emotions. We are told that our colleagues are our competitors, that in order for us to succeed, to be recognized, to come out on top, we must never show them any weakness. We are told that it is me against them. And so we begin to build walls around our fears, around our doubts, and even around our hopes and dreams. For if these are left out in the open, they too might be a sign of weakness. The current rates of burnout and attrition amongst physicians clearly speak to this state of disconnect. According to a recent Medscape study from 2022, it was reported that the average rate of burnout currently amongst physicians increased from 42% to 47% from 2021 to 2022. And in my own specialty of emergency medicine, that rate increased from 43% to 60%. Furthermore, nearly a quarter of healthcare workers state that they are considering leaving the profession in the near future. But this doesn't just affect our careers and our profession. 54% of physicians report that burnout has negatively impacted their personal lives. These statistics are frightening, and unless drastic changes take place, they are only likely to get worse. What is called for is a transformation in the culture of medicine. We need to leave behind the me and embrace the we. We need to leave behind our old separatist ways and walk together into a connected future. But how? How do we do this? Let me get back to my story. So, as I mentioned, having to face cancer, being sick, was what had given me this permission to be me, to reconnect with myself. But unfortunately, that connection was not meant to be long-lived. As I neared the completion of my treatment, and my hair started to grow back, my eyebrows started to fill in, all of those voices of the shoulds also started to come back. And all of my old habits, my old thoughts, my ways of being were very well ingrained. And I didn't know how to step back into my old normal life, the life full of demands, the life that required performance, without falling back into my old patterns. And I was terrified. So much so that there were moments where I wished for my cancer to recur. In my mind, that was a sure way for me to stay connected to myself, to the world around me. So I searched for something that could allow me to stay connected and would also allow me to step into my life, to perform. And this is when I came across mental fitness. Now, mental fitness is the discipline of training our brains so that we can strengthen those neural pathways that give us access to empathy, to curiosity, to creativity, to a sense of purpose, and to courage. Those neural pathways that link us to the best parts of ourselves and the best parts of others. This operating system was created by Shirzad Chamine after performing research on more than 500,000 participants, across 50 countries around the world. And mental fitness is what gives us the ability to develop our neural pathways, to rewire our brains so that we can connect to ourselves and connect to others while we perform, while we are at our best. So going back to the question, how do we transform this culture of medicine? By bringing in mental fitness into the lives of all physicians, and doing this in the context of community. What this means is that all medical divisions, clinical divisions, departments, health systems need to provide opportunities for physicians to come together in groups, in teams, in community, and learn mental fitness together. They must be given protected time to do this for our benefit, for the benefit of the we. We must leave behind the me and embrace the we. Current studies with management teams from business organizations has shown that those management teams that participate, that take part in mental fitness training, report improvements of greater than 80% or more in their ability to use their mental and emotional energy, in conflict management, in self-confidence, in stress management, in their ability to develop others, and even in their levels of happiness. So I invite you to close your eyes for one moment and imagine. Imagine what would happen if we could bring mental fitness to medical teams and they achieved similar outcomes. What would that mean to burnout and attrition rates? What would that mean to the care that we provide for our patients? What would that mean to how we mentor up-and-coming doctors? What would that mean to our most beloved relationships? As physicians, we touch the lives of so many that the ripple effect of this type of intervention would be exponential. So I call you all to take a stand for yourselves, for the we. You can start small, perhaps just by contemplating how many should statements have you already said to yourself today. Consider that most of those sitting around you, working with you, have likely done the same. Perhaps next time when you ask a colleague how they're doing, you can really ask them. Look them in the eye. Give them space to really be, to really share. And by the same token, next time someone asks you how you're doing, don't just answer with the typical, I'm fine. Stop. Take stock of what you're feeling, of where you are, and share. It will be a gift to yourself and to the one with whom you're sharing. But you cannot, you must not stop there. The profession of medicine and its practitioners are in a state of crisis, and big-scale change is needed now. So I urge you to demand for mental fitness to be introduced into your clinics, into your hospitals, into your health systems. It is time that we come together, that we become the drivers of our own fate, and that we demand what the we needs. It is time that we demand for interventions that have been tried, proven to work, and can effectively bring about what we as humans yearn most: connection. Thank you.